name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Thank you for joining me to learn all about apraxia of speech and how you can support someone who has this condition. In this video, we'll discuss what apraxia looks and sounds like. The unclear speech that characterizes apraxia can sound similar to other speech disorders. However, there are a few specific elements that set apraxia apart. Let's take a look at them. One of the first things you may notice with apraxia is a person's inconsistency in how they say words. Maybe they can pronounce the word caterpillar clearly one time, but the next time they say it, it comes out differently and it's hard to understand. This inconsistency is one of the hallmark symptoms of apraxia of speech. Distorted sound production is another apraxia symptom. The person's speech may not be as crisp and precise as it could be, or they may be quite challenging to understand, period. Some people with apraxia can say a complex word clearly, but simple words are more distorted. It's important to note that there can be varying levels of severity. No two people with apraxia will be exactly the same. Vowel production is another giveaway. If a person can't pronounce vowels correctly, this can be a sign of apraxia of speech. A person may say sha instead of shu, or meh instead of me. Even the smallest variation in tongue or jaw movement can affect vowel production, which is why people with apraxia often have this challenge. Groping movements of the mouth can occur as well. This characteristic isn't present in everyone with apraxia, and it's not present all the time, but it is a symptom to be on the lookout for. As a person begins to talk, they'll try to place their mouth, tongue, teeth, and jaw in the correct position. Although the person knows what they're trying to say, they can't get their mouth muscles to move in the correct way during speech. So they move their muscles in a groping type of way as if they're searching for the right position. This is related to the disconnect between the brain's message of what needs to be said and the muscle's difficulty in following that command. People with apraxia may also struggle with their intonation of speech. This refers to the natural up and down inflection we use when we talk. For example, when you're asking a question, your intonation rises a little at the end of the sentence to convey that it's a question. Notice it here. Are you going to the store today? You can also notice intonation in a simple statement. I'm so excited to see that movie. Neither of those sentences sounded monotone. There's a natural up and down movement of the voice and speaking rhythm used to create interest and engagement. People with apraxia really struggle with this. Their speech may sound monotone, or they may use inappropriate pauses and stops while they're speaking. Finally, someone with apraxia may have an easier time with automatic speech than they do with volitional speech, which refers to speech that a person initiates, such as asking a question, making a comment, or participating in a conversation. Examples of automatic speech include stating your name or birthday, counting to 10, saying the days of the week, singing a song you know by heart, and perhaps saying some phrases related to your job. Surprisingly, for adults with apraxia, curse words can also be a part of this automatic speech. Automatic speech is ingrained in us, and it's likely to come out more smoothly than answering questions or making comments in conversation. Before we conclude, let's take a second to recap all of these characteristics of apraxia. The main symptoms include inconsistent errors in speech, distorting sounds, groping for sounds, inappropriate intonation of words, and difficulty initiating speech movements. While there are several distinct characteristics of apraxia of speech, it takes the trained eye and ear of a speech therapist to make the correct diagnosis. To learn more about that, see our video on how apraxia is recognized and diagnosed. Once a diagnosis is made, the right treatment can begin.